Hello, everybody. I'm Mary Angela, the director of the Center on the Hill, and I'm so pleased today to have Joan Adler, a Medicare counselor, with us. She's going to talk to us about Apprise Medicare counseling. Joan?
Hi, I'm Joan Adler. I am a trained counselor with the Apprise program in Philadelphia. Apprise is the name of the local state health insurance assistance program. We're a federally funded program, part of a nationwide network. In some states, they're just called SHIP, but some states give it a cute name, and our name is Apprise. We're funded through the Area Agencies on Aging, which in Philadelphia is PCA, or the Philadelphia Corporation for Aging. We're a nonprofit agency made up primarily of volunteers who are well-trained to counsel clients about their choices in Medicare. We're not associated with any insurance plans, and we don't get paid for signing people up, nor do we get paid for our information. We generally work in the office, but during the coronavirus, we are working from home. We also will go out and make presentations to groups. Volunteers in the office are usually assigned a block of time, and there aren't always people in the office to answer your calls. But if you leave your name and number, we try to get back to you as soon as possible. Any information you give us is completely private and confidential. We don't share that information. We just use it to help you. We're basically here to assist you so you can make the best choice for yourself in Medicare. So just to give you some idea of how we're trained, we have 10 online modules that we have to take, and then we have to pass an exam for each of the modules. After that, we attend a 2-day live in-person training, and we have to pass that 2-day training in order to get certified. Once you're certified, you still have to work with another trained counselor until the people in your agency decide that you're able to counsel by yourself. And beyond that, we still always have access to a supervisor to answer any questions that might come up that we do not know the answer for. As trained volunteers, we discuss some of the following things. We tell you when to sign up for Medicare and when not to sign up for Medicare. We discuss what your costs will be. We explain the difference between premiums, deductibles, co-pays. We also talk about networks and whether your plan might need a referral from your primary for other services. And we discuss whether there are penalties for signing up late. Part A is the hospital insurance. And generally, if you've worked for 10 years in the Social Security system, you don't pay a premium for your hospital Part A services. Part B is your medical and outpatient services, and currently the basic monthly premium is $144.60 for your Part B. Part A and Part B cover 80% of the costs of both hospital and outpatient care, and somebody else is then responsible for the other 20%, and we will get to that. The annual deductible for Part B is currently almost $200, and that means that once a year, you pay the first $200 of your health care expenses, and then Medicare joins in to pay their 80%. There's also a Part D prescription plan, and that we can help you with as well. The average Pennsylvania premium is said to be about $36. We usually can find you a plan for less than that unless your drugs are all very high tier and very expensive. There usually are penalties for late enrollment in all of these parts, and that all depends upon why you are enrolling late. If you had previous insurance or are covered by group health plan where you work, you are not going to be charged any penalties when you stop working and your group health plan ends. We also talk about low-income programs and high-income adjustments. So we assess whether somebody would be eligible for any low-income subsidies, such as Medicaid. You can have Medicaid and Medicare together. The Medicare Savings Program will pay for your Part B monthly premium if you're eligible for that. If you make too much money for those programs, there's an extra help program, which helps you pay for all or part of your prescription medications. If you're not eligible for those programs, there is PACE and PACENet, which are available to people with a somewhat higher income, and they both help also with drug expenses. If you're under 65 and you have Medicare because of a disability, there's an excellent program called Medical Assistance for Workers with Disabilities, and we can help you assess your eligibility and apply for all of these programs. If you're lucky enough to be a high-income individual, we can talk to you about what surcharges you might have to pay, and we can also tell you about forms that you can fill out that may help you not pay for these excess charges. We help the client choose the best Medicare plan for them, and that depends on who the person is, what their medical conditions are, who their doctors are, how much money they want to spend on their health care, etc. So we explain the difference between being on original Medicare or being on a Medicare Advantage HMO. We talk about the Medigap supplement and how that is not the same as an Advantage plan. We talk about special needs plans if someone has Medicare and Medicaid. We can enroll you in the office directly into a Part D drug plan or a Medicare Advantage plan. If you're interested in a Medigap supplement, we explain to you how to go about getting a supplement from a reputable broker. We let the clients know when and how they can enroll in plans and when they can change their plans if their plan is not making them happy. We also help you file complaints and appeals to Medicare. There are also special cases that we know how to help with. Some people, when they retire, get retirement health insurance. We tell you how Medicare works with your retirement plan. Some people get a retirement plan for a limited number of years, and we explain to you what happens when that retirement plan goes away. We talk to school district retirees and teachers about the HOP plan. We can explain to railroad retirees and veterans how Medicare works with their plans. We work with people who are on Medicare because of disabilities, people on dialysis, and people who are what we call dual eligible, and those are the people who have Medicare and Medicaid. We help people understand when they should call Apprise for advice so they don't miss deadlines or certain benefits. So it's best to call when turning 65 or when you're first going to enroll in Medicare when your employment stops. There are benefits that can only be accessed during the first 6 months that you're on Part B. So we want to make sure you don't miss those benefits. We also want to make sure that you don't enroll in Part B while you're still covered by a group health plan, because then you're paying for the same coverage twice. Anyone who's retiring or leaving a group health plan has a special enrollment period in Medicare. We tell you what that will be, and we help you enroll. Once a year during open enrollment, people who have a Part D drug plan should check and make sure that their drug plan is still going to be the best for them in the coming year. And people who have Advantage plans, this is the time you can change your Advantage plan. There's also an additional special enrollment now during January, February, and March of each year for people with Advantage plans to change their plan. Clients can call us anytime, however, if they have Medicare questions, and it's always a good idea to plan ahead. There are 3 places in Philadelphia that have Apprise counselors. One is the place I work, which is Apprise at Einstein Medical Center. The number is up on the screen. If you want to call me directly, the number to call is next to my name. You can call and leave a message, and I will get back to you as soon as I can. There are Apprise counselors at the Mayor's Commission on Aging, and also at CARI, which is the Center for the Advocacy for the Rights and Interests of the Elderly. Although CARI primarily focuses on other advocacy issues, they're very good at helping people file appeals and complaints under Medicare, and they do have Medicare counselors. All of us are trained in the same way under the same system. We all counsel by appointment, so people do need to call us and set up an appointment to be seen. And as I said, most of us are volunteers, so there may not always be somebody in the office when you call. If you have any questions, please feel free to call me at this number, leave your name, number, a brief message about what you're calling about, and I will get back to you as soon as possible.